Even before families get together for the holidays, we are seeing a surge in coronavirus numbers. Over the past 3 days alone, the U.S. reported more than 517,000 new cases, which puts the total since the start of this pandemic above 12 million Americans. Our lead national correspondent, David Begnaud, is in Sioux Falls, South Dakota, a very unique place these days. David, good morning to you. Just how bad is it there?
Well, over the last 24 hours, South Dakota reported 42 new COVID-related deaths. 42. Now, a health expert here in South Dakota says per capita over the last week, South Dakota's reported more COVID-related deaths than any other state in the country. Consider this. You know how some people say, oh, COVID affects folks just like the regular flu? Here in South Dakota, on average every year, they have 48 flu-related deaths. 48. They had 42 COVID-related deaths in just one day.
South Dakotans do not want to be told what to do, especially when it comes to wearing a mask. Just ask the mayor of Sioux Falls, Paul Tinhaken.
This is cowboy country, man, and you try and tell someone to do something, and they want to do the opposite as a result.
The mayor resisted a mask mandate for months, but the city finally passed one, and over the weekend it took effect. But there is no penalty for those who refuse to wear one.
We're at a bar without a mask.
Most people we saw in the downtown area of bars and restaurants were not.
Sioux Falls is putting in a restriction on themselves, but South Dakota in general doesn't care at all whether or not there's a mask mandate or any restrictions to help COVID at all.
22-year-old Nicole Noshel was about to enter a bar when she agreed to speak with us and admitted.
Honestly, I am an RN on a COVID unit.
I don't mean to put you on the spot, but, you know, you are an RN.
Yeah.
You work in a COVID unit.
Right.
Nobody gets it better than you.
Right.
And here you are coming to party without a mask.
I've had it, but that doesn't mean that, I do care about other people and, their health as well.
For the record, the two women decided not to go into the bar after our interview. Even the leader of Sanford Health, the largest health system in the Dakotas, has given people reason to question whether there is a crisis here.
It's hard for me to say we are at a crisis. That would be misleading from a clinical standpoint.
But CEO Kelby Krabenhoff isn't a doctor. His chief medical officer, Dr. Allison Suttle, is.
Would you classify what is happening here in the Dakotas as a crisis?
I would.
One expert in South Dakota says the state has the highest hospitalizations per capita in the country.
Do you believe that the governor of South Dakota should put a mask mandate in place?
I do believe that the governor should put a mask mandate in place, that would help us in our attempt to fight this virus.
The governor has vowed not to. You know, South Dakotans preach personal responsibility.
When it comes to how we pass this infection, I think that we need to step up and say that this is not the police or law enforcement's problem, this is ours.
And every maskless person we spoke to seemed to not only know better, but they vowed to do better.
I came out of a bar where no one's wearing masks, but I believe in wearing masks, and I'm not wearing one, so I feel like a giant piece of crap for not wearing one.
So now that young man knows that there is a mask mandate in effect here in Sioux Falls. Statewide, the Republican governor has resisted for months. She says, I'm not going to institute a mask mandate, though her Republican governor in North Dakota just did. South Dakota's Governor Gayle said, listen, we are not going to stop you or discourage you from thanking God or spending time together this Thanksgiving.
Boy, David, I'm so glad that the RN nurse decided that she wasn't going to go into the bar. You could see while you were talking to her, her face was like, this is a bad idea talking to you about this. So I'm so glad that she turned around and didn't go in.
Yeah.
That's very good news. Thank you, David.
Me too.